Ever woken up with a sharp, debilitating back pain and wondered what caused it? Well, one potential culprit could be a herniated disc. This condition happens when one of the soft, cushiony discs between your vertebrae pushes out through a crack in the tough exterior casing. Imagine your spine as a stack of donuts. The donuts represent your vertebrae, while the cream filling in the middle is the disc. Now, if the cream filling spills out, it can irritate the surrounding nerves, and that's when the pain hits. The symptoms can vary widely, from a mild ache to a sharp burning sensation or excruciating pain. Sometimes it feels like an electric shock traveling down your leg. You might also experience numbness or weakness in the affected area. Understanding the problem is the first step to finding a solution. Now that we know what a herniated disc is, let's delve into how to treat back pain caused by it. Before we jump to surgeries, let's explore some non-surgical treatments. First off, we have physical therapy. This involves targeted exercises under the guidance of a trained professional. These exercises aim to strengthen the muscles that support your back, improving flexibility and reducing pain. They can also help move your disc away from the nerve, reducing inflammation and discomfort. Remember, consistency is key with physical therapy. It's not a quick fix, but over time, it can significantly improve your quality of life. Next, let's talk about over-the-counter medications. Non-steroidal anti-inflammatory drugs, often referred to as NSAIDs, can help manage pain and reduce inflammation. Ibuprofen and naproxen are common examples. However, these should be used with caution and only as directed by a healthcare professional, as long-term use can have side effects. Another non-surgical treatment is lifestyle changes. This might sound broad, but it's incredibly important. Improving your posture, for instance, can reduce the pressure on your discs and nerves. Try to maintain a neutral spine alignment whether you're sitting, standing, or even sleeping. Regular exercise is another crucial lifestyle change. It's not just about strengthening your back muscles, but also maintaining a healthy weight. Excess weight can put additional strain on your back, contributing to disc problems. Diet also plays a part. A balanced diet rich in anti-inflammatory foods can help manage symptoms. Think colorful fruits and vegetables, lean proteins, whole grains, and healthy fats. And lastly, there's the option of using heat or cold therapy. A warm bath or a cold pack can provide temporary relief, especially when used in conjunction with other treatments. So, there you have it. Non-surgical treatments for a herniated disc range from physical therapy and medication to lifestyle changes and heat or cold therapy. They can all play a part in managing your symptoms and improving your overall health. While these treatments can be effective, some cases may require further intervention. When non-surgical treatments don't work, it might be time to consider surgical options. When we talk about surgical treatments for a herniated disc, two procedures often come up: discectomy and spinal fusion. Let's take a closer look at each. Discectomy is a procedure that involves the removal of the herniated part of the disc, relieving pressure on the spinal nerve. It starts with a small incision in the back. The surgeon then moves aside muscles and removes a small piece of bone to reach the herniated disc. The protruding part of the disc is then removed, taking the pressure off the nerve. The incision is closed, and the surgery is complete. Recovery time can vary, but most patients can expect to return to normal activities after 6 weeks. Spinal fusion, on the other hand, is a procedure that involves fusing 2 or more vertebrae together. This is done to stabilize the spine and prevent painful movements. The surgeon begins by making an incision in the back or the abdomen, depending on the location of the herniated disc. Then, a bone graft, usually taken from the patient's hip, is placed between the vertebrae. Over time, the bone graft will grow and fuse the vertebrae together. This surgery is more complex and the recovery time is longer, often taking several months. Both procedures have their pros and cons. Discectomy is less invasive and has a shorter recovery time, but it may not completely alleviate pain in some cases. Spinal fusion, while more invasive and having a longer recovery time, can provide more lasting relief for severe or chronic back pain. It's important to remember that surgical treatments are not a first-line treatment. They are considered only when non-surgical options have not provided adequate relief, and the pain is significantly affecting the patient's quality of life. Surgery can sound intimidating, but remember, it's only considered when other treatments have failed. So, while the thought of going under the knife may be nerve-wracking, it's a step taken towards a life free from debilitating back pain. Treating a herniated disc doesn't end with surgery. It's just the beginning of a continuous process of care and maintenance. It's vital to understand that post-treatment care plays a significant role in ensuring you regain total spinal health and prevent future complications. Let's talk about physical therapy first. It's an integral part of post-treatment care. Specific exercises are designed to strengthen the muscles that support your spine, improving flexibility and reducing pain. These exercises often involve stretching, strengthening, and low-impact aerobics. Remember, it's essential to work with a professional physical therapist to ensure you're doing the exercises correctly and safely. But it's not just about physical therapy. Lifestyle changes are equally important. Keeping a healthy weight, for instance, can alleviate undue pressure on your spine. Regular exercise beyond your physical therapy sessions can also help maintain a healthy weight and improve overall spinal health. Whether it's a brisk walk, swimming, or cycling, find an activity you enjoy and make it a part of your routine. And then there's diet. A healthy diet rich in calcium and vitamin D can promote bone health, including your spine. Incorporating foods like dairy products, leafy greens, and fish into your meals can provide these essential nutrients. To sum it up, post-treatment care for a herniated disc involves a comprehensive approach that includes physical therapy, lifestyle changes, and a healthy diet. Remember, a healthy spine is a happy spine. Let's quickly recap what we've learned today. We've delved into the complex world of herniated discs, recognizing the symptoms and understanding the root cause. We've explored non-surgical treatments, showcasing the power of physiotherapy and medication. We've also shed light on surgical treatments, demystifying the process for those it may concern. Finally, we've emphasized the importance of post-treatment care, a crucial step on the road to recovery. While back pain from a herniated disc can be debilitating, remember that there are multiple treatment options available. Always consult with a healthcare professional for the best course of action.